Hey everyone, I'm Sarah Lavonne and welcome back to my YouTube channel. It has been a minute since I have gone over any high-risk pregnancy condition, and so today I'm going to talk about one of the most common complications of pregnancy, which is high blood pressure. So there are various classifications of different types of what we're going to call hypertensive disorders of pregnancy, which hypertensive just means high blood pressure in pregnancy. And so I'm going to clarify between all of the different types today. I'm going to talk about what that means, what signs and symptoms you might see, and then I'm going to come back for part 2 and talk about if you are diagnosed, what that looks like for your labor, your pregnancy, and your birth and postpartum courses. But before I get started, make sure you subscribe down below, and I would love it if you shared this video with any of your mom friends or your pregnant friends or your mommy groups. And then let's get going. Preeclampsia might be a word that you have heard if you are pregnant, or maybe you had your baby already. Maybe you were diagnosed with preeclampsia. And so I want to clarify what is preeclampsia. But before I can do that, we have to go back to just blood pressure in pregnancy. So throughout your pregnancy, you're going to go to your prenatal visits with your doctor or your midwife, and they're going to check your blood pressure while you're there. What they're checking for is we do not want your blood pressure to increase throughout the pregnancy. It could increase prior to the pregnancy. You may go into your pregnancy with already elevated blood pressure. Blood pressure really just means that the pressure in your vessels are pushing blood where they need to go. Where do we care? We care, of course, your brain, your heart, your lungs, your vital organs. Obviously, your entire body really matters as well, but we really care about those vital organs. And then once you're pregnant, we want enough blood pressure to perfuse or push that blood, which carries oxygen through the placenta to the baby, helps your baby grow and survive, right? So we need enough blood pressure, but we also don't want too much blood pressure. It's like almost like if I were to squeeze a water balloon and there's so much pressure on that water balloon, what's gonna happen to the water balloon? It's gonna pop, right? And so we don't want too much stress on your blood vessels, which can cause complications, which I'm getting into, okay? So we want your blood pressure within normal range. Normal range for pregnancy is different than normal range for somebody who's not pregnant. In general, if you've heard about blood pressure before, kind of the key word we say is we want your blood pressure below or at 120/80. That's sort of standard. There's different classifications. If you're a little bit higher than that versus below that. If it's under that without pregnancy, fine. But in pregnancy, we really allow for a little bit of an increase in blood pressure under 140/90. So long as your blood pressure is stable or under 140/90 during your pregnancy, you're good to go. Your provider is going to watch it and then pay attention. Now, what happens if you have elevated blood pressure throughout your pregnancy or even during your labor and birth? What we are concerned about is that blood pressure being an indicator that there's something else going on in your body, particularly maybe preeclampsia, okay? What if you have elevated blood pressure, so above 140/80, before you even get pregnant? That would be considered chronic hypertension. So chronic just means over time, over a lot of time, that you've had high blood pressure or hypertension throughout your lifetime. That does increase your risk of potential complications during the pregnancy, one of them being it developing into what we would call in that case a superimposed preeclampsia. Preeclampsia, same. They'll all kind of be looped together, but you have a little bit higher risk of that going in and knowing that you already have that elevated blood pressure. But sometimes you're diagnosed with that elevated blood pressure above 140/90, and they have to have 2 readings 4 hours apart that says, yep, you have that elevated blood pressure. Maybe it's consistent. After 20 weeks would be considered a gestational hypertension or high blood pressure. And that just means we're watching it. You may be looking at an earlier delivery or birth being induced earlier, but it's there's something going on in the body. We don't want your organs affected and getting sick. And so they're gonna watch that really closely throughout the pregnancy if you have those elevated blood pressures, probably consistently after 20 weeks, okay? So that's not preeclampsia. In order to have preeclampsia, they're going to test your urine in 3 different ways. They're not going to do probably all 3, but they need at least probably 2 of the 3, they could quickly dip your urine. So maybe in the office, whenever you give a pee sample, they're looking for protein in your urine. And that means that it could be progressing to a preeclampsia where now your organs are being involved or being affected by that high blood pressure in pregnancy. If you're still pregnant and you're not at term, so 37 weeks and beyond, they may have you do what's called a 24-hour urine collection, where literally you pee in a cup for 24 hours, you keep a big jug of your urine in the fridge for 24 hours, then you bring it to the lab, and then they look for a protein amount in that urine. Now, if they don't have time for a 24-hour urine collection where you're going home saving your pee, they may just draw a lab and look for a urine protein creatinine ratio. All that means is, are the kidneys being affected? Are you putting protein into your urine because this high blood pressure pregnancy is affecting your organs, particularly your kidneys in this case? Now, if you come back with those levels elevated, that with the high blood pressure can rule you in for what we call preeclampsia. And preeclampsia is just a pregnancy-specific syndrome that means you have that elevated blood pressure with protein in your urine. Why do we care? Because anybody with elevated blood pressure, I will say, even if you have a gestational hypertension, you are at risk for this stuff because it can progress into preeclampsia. But preeclampsia, the biggest concern is, one, that it puts you at higher risk for a seizure. If you have a seizure, that can lead to a whole slew of other complications. We don't want you having seizures. We don't walk around having seizures on the regular. That's not what we want. It's not good for you. It's not good for your baby. And 2, if the blood pressure isn't controlled, that what can happen is the disease process just keeps affecting your organs. And so then if the blood pressure gets too high, you can actually have a stroke. So those are two kind of like seizure and stroke are not ideal for anyone. We want to keep you healthy. We don't want you to progress. We ideally want you to be stable throughout the pregnancy, and which is why they're watching this stuff so incredibly closely throughout your pregnancy to make sure that you are safe, that you're not getting sicker, because the only cure for preeclampsia is delivery of your baby. So you ask the question, what happens? Well, what if I'm 31 weeks and I'm having these symptoms where I have protein in my urine and I have this high blood pressure, and then something else that I'm going to tell you in a second, which is really the risk. They are going to be weighing, is it time to deliver? Should we keep you pregnant? How involved is this disease process? Can we hold off and help regulate your blood pressure, keep it low enough that it's not in the scary range? Or should we actually move our way towards birth? And that means induction or C-section. I'll come back in part 2 for that piece of it to lay out what it could look like if you're hospitalized with preeclampsia, or you're in labor with preeclampsia or gestational hypertension, because it can develop at any point in the course of your labor, pregnancy, birth, and postpartum. So then they're weighing and saying, should we really deliver? Let's say you're 38 weeks. It's going to likely be safer for you to move your way towards delivery or birth versus wait, okay? And wait to see because we know it's not gonna get any better. So we need to manage those symptoms and weigh. Your provider, your doctor is probably gonna do that, probably meaning they are gonna do that, of weighing, should we keep you pregnant or should we move you towards delivery? So you have to have 2 criteria in order to meet the preeclampsia diagnosis. Elevated blood pressure is baseline. You have to have those elevated blood pressures consistently over 140/90. Or you have protein in your urine tested by a 24-hour urine collection or by a PC ratio. Technically, they could dip your urine, but it's not as accurate. And the other thing that can happen is we see signs and symptoms that your organs are being affected by the preeclampsia. What does that mean? We draw some labs and we look at your labs and we say, oh, her platelet count is going down, or, oh, we're looking at her liver enzymes are being affected, meaning the liver's being affected or the kidneys are being affected, that instead of just high blood pressure, which is stressful on the body, and now spilling protein, that now we're having symptoms, which leads me to, what would you see if you maybe had that elevated blood pressure at home that would be your warning signs for preeclampsia? You may have heard these already. I have mentioned them in my warning signs for pregnancy video because this is actually common. About 5% of pregnant people will be diagnosed with preeclampsia every year. So of the people that are pregnant. So this is not something that's like the one-off that never happens. This is something that we see pretty regularly in the hospital. And so you want to be aware of the signs and symptoms. So what are the signs and symptoms that we ask you to pay attention to? One would be headache. And headaches are normal. So we have headaches. I have a headache, minor one right now, actually, probably because I haven't had enough coffee yet today. And so if you have a headache where you're like, wow, I feel pressure in my head, I am uncomfortable, you drink some water because sometimes dehydration can cause a headache, you have a Tylenol, which you can have in pregnancy, always check with your provider first. I'm not telling you to ingest anything, that's general disclaimer, but in general, Tylenol is safe for pregnancy. You take that Tylenol and you still have that headache. That's concerning. We want to be aware to make sure that that's not a symptom of an elevated blood pressure. The other thing you might have is any kind of visual disturbance. If you read in books, that's what it's called. Basically what that means is blurry vision, spotty vision, little floaters. You're like, my vision is changed. It's different, especially coupled with a headache. We want to pay attention to that. That warrants a phone call to your provider. No matter what your gestational age or how far you are in your pregnancy, we want to make sure that we don't have a high blood pressure thing going on here, okay? The other sign and symptom to report is what we call epigastric pain or right upper quadrant pain. So really, epigastric is truly in the middle, and you think about pregnancy, like people have indigestion, they have heartburn in pregnancy. That is different than like a dull epigastric constant pain that's either midline in the middle or more off to the right. That could mean that your liver is being involved in the process. So if you're like, I have this achy feeling in my right upper quadrant of my abdomen, I'm having floaters, I have a headache, those are 3 of our heavy hitter signs that you could be developing a preeclampsia. Throughout your pregnancy, we want you to report those to your doctor, okay? What will they do? They're going to send you in for evaluation. They're going to want to take your blood pressure. They're going to want to see how high it is and then go from there as far as treatment, which I will get to in part 2. So you want to be aware if you have any of those signs and symptoms, you're reporting to your provider and then going from there as far as what they're going to do. Now, let's say you have access to a blood pressure cuff where you could take your blood pressure. How to take a blood pressure. So basically you're gonna put the cuff on your arm with the little line that says artery, or there's like a little like arterial line, maybe a picture of a blood pressure cuff person where the artery of your arm is gonna be right here. You want that aligned on the upper part of your arm, not on the crease. You want it on this upper part of your arm, okay? That's number 1. Then you're gonna sit, you're not gonna cross your legs are gonna come out in front of you. Sit up straight, relax, take some deep breaths, okay? Not laying on your side, not talking, not moving around. You wanna just relax and settle in, and then you'll take the blood pressure and click the on button or whatever. And then you just breathe through it, stay nice and calm, and see what the blood pressure is. If it's over 140/90, you're gonna wait for about 15 minutes, just settle in, try to just lull yourself to a restful place, and then you would retake it. And if it's still elevated, then we definitely wanna report that back to your OB. Now, if it's below 140/90, I'm still gonna tell you, call your obstetrician's office and say, hey, I'm having these symptoms, my blood pressure is this. They're gonna be very impressed with you, and then they'll guide you thereafter what to do. When is it really concerning? And when would it warrant going to the hospital? Especially if you have signs and symptoms, you're gonna go if your blood pressure is above 160/105. And mind you, a lot of you are not taking your blood pressure at home. Obviously, check with your providers on even if they want you to do this. But if you are suspecting this, or you're having symptoms, or you're nervous about it, a blood pressure cuff can be purchased anywhere. I'll link one down below to get on Amazon, even just to be aware of, especially if you have a family history of preeclampsia or you have elevated blood pressure already, something to pay attention to. If you ever get a reading above 160/105 and you repeat it 5 minutes later and it's still that elevated, especially if you have symptoms, that warrants a go to the hospital for evaluation situation, okay? You can always call your provider, but in that case, that's when we really start to get worried, because that's when we would potentially be giving meds and we need treatment quickly. Knowing that, Preeclampsia is not going to just miraculously heal itself until you have your baby. And even after baby, you're gonna wanna pay attention to how you feel, what your symptoms are, because even after you have your baby, you technically can develop preeclampsia as well. I hope that answered a bunch of your questions to get us going in the conversation about preeclampsia. This stuff is pretty complicated, so I hope that I dulled it down enough that you have enough of an understanding and knowing what to look for. That's the biggest thing. I don't want you to be afraid, but it's important to empower yourselves with the knowledge and education to know, could there be something going on that I need to report? And that knowledge is power for keeping you and your baby safe. If you have any other questions for me, feel free to throw those in the comment box down below. Make sure you subscribe because I will be coming back very soon for a part 2 all about preeclampsia to discuss what happens if you are diagnosed with preeclampsia and specifically for your labor and birth, what options you have, how that might look different, what you can expect as far as maybe some medications and side effects of those. So make sure you subscribe down below so you don't miss that. And then also, even if you don't have a preeclampsia, it's so important to empower yourself with that knowledge for your labor and birth so that there's way less that is the unknown. There's always so much that's flex and flow with labor and birth, but when you have that baseline, if you're faced with a preeclampsia diagnosis, you're like, wait a second, I know all about this. It's not as scary because it's not like this big syndrome, pregnancy syndrome that's so overwhelming. It's like, no, I know about this. I know what the steps are, and I know that I'm in the hands that are there to keep me safe. If you don't follow me on Instagram, head on over to Instagram and follow Bundle Birth. There's more information over there. And then if you haven't taken a childbirth class yet, especially a coping with labor class, whether you intend for an epidural or not, I have all of those classes, including VBAC class and an infant safety and CPR class on my website. Everything's in the description box down below. And then until next time, don't forget to flex and flow, and I will see you very soon. Bye.